right, now we will review how to do a Follistim pen injection. So a couple of things to gather to do this type of injection. You will need your pen. It'll typically come just empty in the box with the rest of your supplies. You will also have these little guys in there. I call them needle caps, but this is eventually how you will actually administer the injection. So grab one of these. You will also need to grab your cartridge. Depending on your dose will depend on how many and how many unit cartridges that your provider ordered for you. These do need to be refrigerated. They come in their own box, so be sure when you get your shipment of medications that you open this up and put those boxes right in the fridge. But when you take it out, they will look like this. So grab that. Then you also want to grab an alcohol prep pad so that you can cleanse the site of injection. And then you'll also need your sharps container handy as well. So to prep this pen for injection, I usually recommend just taking the cap off so that you can kind of see what you're working with. So here is where you will end up loading your cartridge. And then down here, you can see that there's a window there with various numbers, and we will go over that here shortly. So in order to get the cartridge into the pen, because in your cartridge is your medication, so you have to load this up. Here you can see where the arrows meet. You're going to twist that apart, and they'll come apart. You can see the plunger here. Then you will just kind of hold the top of it down, and that's where your cartridge will go in. So you can see on the one end there's a rubber stopper, and the other end has a bit of an opening where this will eventually go into this plunger. So when you're loading it up, the side with the rubber stopper goes down into the top of the pen, and then this goes together here. Press it, and then this will screw on there, and you'll hear it click. And you can also double check yourself because your arrow should match up with that line there. That's how you know everything is loaded and appropriate to prep with the needle for the injection. So at this point, you can take your needle cap here. You will see the paper there. This peels off. You can just take it off completely. Inside of there is the needle, so be careful not to prick your finger on the end there. And then this is going to just twist onto the Follistim pen. So you'll twist until it's nice and tight. And then at this point, you can take off the big cap, and then there will be a sheath there. This is kind of your last line of defense before the actual needle is exposed. So now you will want to turn so that you can see the numbered window facing you, and you will dial it until you see the dose that you are ordered for. So for the sake of the video, I'm going to go with a dose of 150. So you will dial until your window matches your dose. One thing I want to show you as well before we actually do the injection is, say I accidentally went too far with my dose and I accidentally went to 175. Instead of going backwards, you don't want to twist it back to the 150. You actually want to twist this all the way out until it won't twist anymore. And then that's how you reset it, and then you press it in and it kind of twists back in to 0. That's how you can reset it if you go past your ordered dose. So I will twist again here to 150. Okay. At this point, you are ready to prep the skin for the actual injection. So this is a subcutaneous injection, meaning it goes into the fatty tissue. So just under the skin. There's different locations that you can do subcutaneous injections. Some clinics and providers have their personal preference. I'll review just a couple of places that typically are fair game for subcutaneous injections. So you can use the abdominal tissue, kind of the belly fat. You can also use the outer part of the thigh as well, or even the back of the arm. Anywhere that you can pinch an inch, kind of like I'm doing here, is pretty much fair game in any of those areas. But I would confirm to make sure that your clinic doesn't have a specific site that they prefer you to use. So once you have chosen your site for injection, you will take your alcohol pad, open it up here. And for today's video, this is going to be my subcutaneous tissue. You will cleanse the skin in a circle, working your way out. Let that dry completely. Once that area is dry, you will take off that colored sheath. This is, like I said, your last line of defense. So you can see the needle is now out. When you are doing this injection, I usually recommend having that window with the numbers face up toward you while you're doing it. Reason being, you want to be sure that that window goes all the way down to 0, meaning that you got your full dose. So hold that window up so that you can see, and then you're going to go in fast at 90 degrees like a dart into the skin, all the way to the hub of the needle. Shimmy your hand up, press that plunger so that it goes all the way down to 0. Once it's down to 0, you can let go and then take that needle out. This point, you want to take that bigger needle cap, not that small colored sheath, recap your needle, and then you'll be able to twist it off. This part goes into your sharps container, and then hold on to your pen with the cartridge inside. You can put the cap back on. If you have medication left in that cartridge, you want to hang on to it, put it back in the refrigerator until your next dose, and then it's ready to go. So you don't need to necessarily take out the cartridge after every injection. I would just leave it in there until the cartridge is completely empty. Then you just unscrew it like you normally would, take out the cartridge, put the cartridge in your sharps container, and then load up a new one if you need, further days of injection. And that is how you do the Follistim pen.